Hey guys, Jeff Nelson here. There's been a lot of talk recently about sugar and weight loss, and this is because of the work of a guy named Walter Kempner who invented the rice diet, I don't know, 50 or 60 years ago, and has published a lot of research on it. And the rice diet is a diet of white rice, fruit, processed sugar, and fruit juice. And we know that this diet is successful in reversing a number of diseases like kidney disease, diabetes, diabetic retinopathy, and heart disease. And Dr. Kempner proved that in the medical literature a number of times. So now how about weight loss? What do we know about sugar and weight loss? Well, we have a study here from Dr. Kempner. This is from 1975. It's called Treatment of Massive Obesity with the Rice/Reduction Diet Program. And so let's look at some of the results here. This is a study of 106 people. These are just some examples. This is a 54-year-old guy. He lost 132 pounds in 144 days. That's about 5 months. His blood pressure, everything improved, got off medications. Here's another. This is a 25-year-old guy. He lost 277 pounds in 379 days. So that's just over a year. And his numbers also dramatically improved. Here's a 48-year-old woman. She lost 115 pounds in about 8 months. She got off her meds and had, huge improvements. And then there's one more example. This is a 19-year-old woman. She lost 123 pounds in 352 days. So that's about a year and normalized all of her numbers. So now let's look at how they lost this weight while eating white rice and fruit and sugar and so on. And we go here to methods, and it says the initial diet prescribed for most patients is a low-calorie, 400 to 800 calories per day average estimated adaptation of the rice diet. And then you go on, you see that lasts for a month, and then after a month, after the initial phase of treatment, some additions such as vegetables are made to the diet, and still later others such as lean poultry or meats are added, but always the prescribed diet is low in calories, less than 1,000 calories a day. Then they go on to talk about exercise. There's a daily minimum exercise program prescribed to exercise to the point of maximum tolerance in terms of subjective comfort. Environment, these people start out in a clinic to learn this diet and they get a lot of support. And then there's a thing called motivational enhancement that they talk about where they give 24-hour urinary chloride or sodium excretion. So they get urine tests basically. It's like drug testing to make sure that they're sticking to the diet. It says non-adherence to the diet can be detected by the finding of high values or by the failure of the patient to provide a specimen. And they use this information so that the counselors can encourage the patient to adhere better, but also peer group pressure, since the results are posted with the high values circled in red, and that you can kind of shame people into sticking to the diet because other people in the group are going to see that they're cheating. So here in the comment it goes on to say that this program, it involves a combination of dietary manipulation, exercise, environmental alteration, and motivational enhancement. Each factor appears to be important. The reduction of calories is obviously the cornerstone of any weight reduction program. The rather severe caloric restriction allows for reasonably rapid weight reduction, which is important if the patient is to remain motivated until normal weight is achieved. So we know from the work of Dr. Kempner that you can reverse, serious diseases by eating a rice diet. That's rice, fruit, sugar, juices. And the rice diet is generally about 2,000 calories. People do lose some weight when they switch from the standard American diet, eating that diet. But for fast weight loss or for people that have a lot of weight to lose, then of course Dr. Kempner always restricts calories. And of course Dr. McDougall uses a principle of calorie density for people to lose weight who want to lose weight. That's to become aware of how calorie dense the foods are they're eating and focus on the ones that are less calorie dense, eat as much as they'd like so that they're full, they're happy, they're satiated, and the weight then, just rolls off. So that's it. That's Dr. Walter Kempner. Talk to you next time.